Some common hand conditions we see in my office are arthritis of the thumb, base of the thumb usually, carpal tunnel, trigger finger is pretty common as well, and different types of tendonitis. So signs and symptoms of carpal tunnel would be numbness, specifically at nighttime or at certain activities, pain in the wrist going into the fingers, specifically the thumb, the index, and the long finger. Arthritis would be just pain, worse with weather, worse with activities, specifically the joints that are hurting, those are the ones that are usually arthritic. And then tendonitis would be basically pain and disability in the areas where they're having pain, usually the elbow. So many of these can be treated non-surgically for a while, if not forever. A lot of them, anti-inflammatories, splinting, injections are some of the ones we use for basically all of the things that we see in clinic. So usually when they come to me, if they haven't tried non-surgical options for whatever they're seeing me for, carpal tunnel arthritis, then we'll try those. When those don't work, then we'll talk about other more invasive things, injections, and if that finally doesn't work, then surgery. And so with arthritis, there's a very common surgery for basal joint arthritis, which is of the thumb. We take some of the bones out that are arthritic, and we reconstruct the ligaments of the thumb. For carpal tunnel, we do a carpal tunnel release. There's different ways to do it. I actually do a different technique. You can do them with the older incisions that are a little bit more invasive. I do that as well, but I also do endoscopic technique, so I use a scope, smaller incisions, quicker return to work, and a little bit better strength after surgeries. So typical recovery for carpal tunnel, I like to do it with the endoscopic technique if possible, and usually by a couple of weeks they're doing very well. Most people go back with it to work within a few days unless it's very demanding. So if I do surgery on a Thursday, they're usually back to work on a Monday. They just can't do heavy lifting. So heavy lifting I would prevent them from doing from anywhere from 2 to 4 weeks, and then they can do whatever they want.